All right, thank you. I'll get us started here in just a couple of minutes. We have one more minute and I see people are still popping in and out a little bit, so. I like the pictures people have. I need to figure out how to have a decent picture of myself and not just my name. Okay. I believe it is 4 o'clock according to my clock, so I'm going to call this meeting of the Regional Transit Partnership to order. Good afternoon, everyone. It is really lovely to see folks and to participate in our very first Regional Transit Partnership Zoom meeting. And because it's our first Zoom meeting and I have notice of an electronic meeting that I have to read, so I will start with the official reading right now. This meeting of the Regional Transit Partnership is being held pursuant to item 4.0-01 of the approved state budget, House Bill 29, that allows public bodies to hold electronic meetings in the current COVID-19 emergency, in that it is impractical or unsafe to assemble in a single location, and that the purpose of the meeting is to discuss or transact the business statutorily required or necessary to continue operations of the public body. This meeting is being held via electronic video and audio means through Zoom, online meetings, and is accessible to the public with closed captioning. And there will be an opportunity for public comment during that portion of the agenda. This meeting is also accessible by telephone conference call. Notice has been provided to the public through notice at the TJPDC offices, media, website posting, and agenda. The meeting minutes will reflect the nature of the emergency. The meeting was held by electronic communication means and the type of electronic communications means by which the meeting was held. A recording of the meeting will be posted at the tjpdc.org website within 10 days of the meeting. And get to my next page. Again, I welcome everybody to this virtual meeting. We will do a roll call. I'm going to ask Sarah shortly to do a roll call of all the voting and non-voting members so we can establish a quorum. But first, I just want to give a couple of reminders. Please mute your telephone or your computer until you're prepared to speak. We ask that members either use the raised hand function of Zoom or ask in the chat room to speak. Conference call attendees may use #9 on their telephone to raise their hand to speak. And
*9.
Oh, *9. Oh, I misread it. I'm sorry. *9 on their telephone to raise their hand or speak. And I'll then be notified and we'll be able to call on you. During this meeting, motions and seconds may be presented without the use of a hand or chat feature. I will restate the motion with who motioned and who seconded, and then a discussion period will follow. To expedite votes will be by voice unless we decide that, in fact, we need to have a voice vote for some particular reason. I'll ask all in favor of the motion and then ask all opposed, any abstentions. And community participants will be allowed to speak during the designated public hearing and public comments period. They should follow the same guidelines for use of raised hand function or chat function. Outside of these times, all visitors will be maintained on mute and speakers will be limited to 3 minutes each. Sarah and Jessica will be keeping time limits and following the requested speakers, and that is mine, and I terribly apologize. It's gone. And with that, I think, Sarah, would you mind calling the rolls or the names for the voting and non-voting members so we can establish a quorum and identify who's at the meeting?
Yes, Diantha, I would be happy to. So
We have Diantha McKeel,
Here.
Lloyd Snook, Lucas Ames,
Here.
Randy Parker, B. Lapisto Kirtley,
Here.
Nakia Walker,
Present.
Neil Sherman. He will be joining us at 5. He let us know via email. And Becca White.
Right here.
Okay. Staff, we have Chip Boyles here in the office and myself, Sarah Pennington, Jessica Hirsch-Ballering.
Here.
Non-voting members, Karen Davis, JAUNT. Brad Shetfield, JAUNT.
I'm here.
Garland Williams, CAT.
I'm here.
Trevor Henry from Albemarle County.
Present.
Okay. Let's see. James Mann, CAT Advisory Board, where he will no longer be with us in this group. Kim McManus from PVCC. Jim Foley from Albemarle Public Schools.
Present.
Okay. Allison Dutnak from the CTB. Chris Rowland from JAUNT.
Here.
Okay. Doesn't look like, I think we have yet a representative from Greene County. And then last but not least, we have Sally LeBoux from UVA Hospital. Okay. And
So
Lucinda Shannon is also here from the TJPDC, correct? Lucinda, are you there?
Yes, I'm here.
And Gretchen Thomas from the TJPDC.
Yes, I'm here as well.
Okay, I believe that completes our list.
Great. And we have a quorum.
Yes.
All right, that's great. So with that, the first item on our agenda is always matters from the public. So with that, I can open it up if you all will for public comment.
And Sean Tubbs is requested to speak.
Okay.
Hello, everybody. I'd like to echo what Becca White says. It is great to see you all in this capacity. Just real quick, I'll try to be as brief as possible. Hello, and thank you for the opportunity to speak today. It's been a rough 11 weeks since the state of emergency was declared, and I know that transit has been hit hard all over the Commonwealth and throughout the nation. I salute all of your drivers who have been serving the riding public who depend on these systems to get around, especially during these times. I actually recall that the last public meeting that I attended in person was the Albemarle County Budget Work Session on March 11th. A major focus of that meeting was transit funding, and I'm looking forward to hearing an update on what the outcomes were, as both Charlottesville and Albemarle have now passed their revised budgets. But today, I really want to look to the future and to remind you that the goal of this partnership is ultimately to reduce greenhouse gas emissions. You are here to build a system that makes it easier and hopefully seamless for people to live their lives without getting in a car, should they choose. Now, these past 11 weeks have given us a glimpse at the air quality improvements that can be made if vehicle miles traveled are reduced. The relationships between all of the players at this virtual table must be focused on creating a regional system that serves the public good. I don't see it on the agenda specifically today, but one uncompleted goal of this partnership so far is to take a deep dive and a look at a similar system. Blacksburg has been the one that we've talked about, and even though we might not be able to go there anytime soon, I suggest that this is a time to begin that study anyway. And to that end, and sort of through a little bit of serendipity, I had the chance to participate in a webinar held by the NAACP's Montgomery County, Radford City, Floyd County branch related to equity and transportation. And preparing for that, I did some basic research into how transit works in the New River Valley and how it came to be. I think there's a lot that we can learn and they can learn from us. I'm going to be following up by helping people in that community get acquainted with some of the jargon to help people get to the table. Making contact and beginning regular communications with officials in the New River Valley is the right thing to do now. In that conversation and on that panel, we were talking about the second daily Amtrak train, which I'm told might eventually extend to Christiansburg or even Blacksburg. We should understand how we can help with that effort since we will become much more connected. I'm also learning from my colleagues in the Virginia Conservation Network about how transit works in other peer communities in Virginia. I can say that the situation here in Charlottesville is unique, with multiple transit agencies working in the same area. I'm concerned that 2.5 years into this partnership, there still seems to be a lot of friction. And that friction is an obstacle to the greater goal of this partnership, which again is to reduce vehicle miles traveled. We're watching closely. Thank you for your time, and I look forward to all you have to say today.
Thank you, Sean. Is there anyone else that was signed up to speak? Or anyone else that from the public that wanted to speak?
Yes, it looks like Gracie would like to speak next.
Okay.
A lot of people here, so making me nervous. I just wanted to talk under 3 minutes to mention 2 rides in this scary, just maybe I'm paranoid, but just to mention that sitting in seats and not knowing if they're cleaned, I don't know, more than they are required to be. I don't know how contagious this thing is. And so I rode bus route number 10 recently. 2 gentlemen came on with no masks and sat less than 4 feet away from me, talking loud, talking about cigarettes and getting off at Food Lion and stuff. And I was on my way to Martha Jefferson for an appointment. And then JAUNT, I don't understand the garbage bag things. And the one gentleman, my most recent ride, he told me to sit in one without a garbage bag over the seat. And that is it. That's just all I'll say for now. Thank you.
Thank you, Gracie. Would you mind giving us your complete name for the record?
Certainly. May I type it?
Yes.
Fine, sure. And I think some of your questions will be answered as we go through the meeting by Garland or by Brad Sheffield, and Garland Williams. So we'll move on. And are there any other speakers who want to make public comment? All right.
I believe that's it.
Okay. With that, then, we had in our packet the minutes from February the 27th of 20, which was our last meeting. Seems like a long time ago. I'm going to ask for a motion to approve in second, and then after those motions, we can discuss if anyone has any changes or any edits to those minutes. So, is there a motion to approve?
I'll move.
That's Randy, I believe, has made a motion.
Yes.
And a second from B. All right. So B has seconded the motion, and then I'll open it up. Are there any concerns or questions about the minutes? All right. Hearing none, then I'm going to call for a voice vote. All those in favor?
Aye.
Any opposed?
Aye.
And any abstentions?
I'm going to abstain since I wasn't at the.
Okay, so Nakia abstains. All right, so that motion for the minutes passed. And then the first actual item on our agenda is the transit service projection. I'm sorry?
I'm sorry, that was a February meeting. If Nakia wasn't there, then I wasn't there either because I sat next to her. But I think you, Diantha, can understand my confusion.
Okay, all right. So we have 2 abstentions, I think is what we're saying. All right. So, so the first item on our agenda is the transit service projections, immediate and post COVID-19. And Chip, I guess I'll turn that over to you.
Okay, glad to, Madam Chair. We asked the directors of both JAUNT and CAT just to give us a narrative kind of description of both what's happening with both of their systems now operating under COVID-19, and then their ideas, even though I think we all accept nobody really knows what's going to happen, but at least they're the most knowledgeable of ideas of what we can expect to see the systems operate as we come out of the COVID-19. So it's kind of a current snapshot and then what we can expect in the future. And so I will perhaps, if we could start with Mr. Williams from CAT, and then we'll get to Mr. Sheffield from JAUNT.
Great, thank you. You need to unmute. Unmute yourself.
Just did. All right.
There you go. We all do that.
Part of the discussions, we've been looking at how we project to finish at the end of the year. One of the things I was working through, and we're actually scrubbing the numbers right now, is that we have a payroll that just went in yesterday, so we're trying to get accurate numbers. We're projected to probably be about $400,000 savings, but that is because we're supplementing our current expenses by using the CARES money. If the CARES money wasn't there, we'd probably be at about $500,000 in the hole at the end of the year. To date, we've spent about $1.1 million of the CARES money from our 5.3 that's coming into our coffers. So at this point in time, our ridership last month was down to 29,000 riders, which is right around where we thought it would be, about 87%, about 90% down, which is kind of a standard around the country. Hoping that that number will eventually come back. It will not. I don't think it's going to be a V-shaped recovery. It'll probably be a very protracted, long J curve. We're hoping that individuals start feeling a lot more safe about what we're doing. So to touch on what Grace said about our cleaning efforts, one of the things I wanted to highlight as a part of our program is that we have brought on a professional cleaner. We clean our buses every single night. The professional cleaners do it every single weekend. We upgraded our cleaning products, our disinfectant products to CDC hospital grade products. We actually do a middle of the day wipe down of all of our high touch areas, the rails, the seats, the back of the seats, at our downtown transit station at between noon and 2 o'clock, depending on what happens here at headquarters. So we're doing everything we think we can. We're actually doing an additional upgrade. We've had, as a part of the CARES money, we can do upgrades to our facilities and buy capital products. We actually bought on a fogger to help us disinfect the vehicles. That actually just arrived 2 days ago. We've been testing it out. That's going to help with a deep cleaning of our vehicles. So we'll turn it on. It'll do about a 15-minute fogging. It'll stay wet for about 4 hours and allow us to really get in and deep clean all of our seats, since we have cloth seats. So we're doing what we think is everything we can to make sure that not only our drivers are safe, but the public is safe and they feel comfortable riding our vehicles.
Thank you, Garland. Brad?
Chip, did you get that ridership graph I sent you? If
Yes,
not,
we got it.
okay.
Do you want it up right now?
Sure, yeah. I'll
Give me
illustrate
just a
just
second.
I've been sharing a tracking that we've been kind of looking at internally with the council and the board on a somewhat irregular basis, just to give you an idea ongoing of what the riderships look like. I sent the most recent one to Chip and Sarah, if they're able to bring that up. It kind of just shows the trend of our ridership since the pandemic started. If you're not, I could probably share my screen.
Okay, try that.
Okay. So what you see from my screen is that trend. The blue line is what applies mainly to the urban ADA services. The rest of the lines relate more to rural services or the commuter services. Paying attention to the blue and dash line, you have to ignore that very last dip. I noticed right after I sent this that represents Memorial Day, which we didn't have a lot of ridership on Monday. So of course there is that dip, but we are seeing ridership tick slightly back up. So we are still monitoring the necessity of the trips that are being requested, and we're not quite sure what may be that, other than there's been some relaxed rules regarding things like elective surgeries and medical care, those kind of things. So we'll continue to report those things out. I have no idea when we'll see services rebound almost completely. But we do know it'll be a slow climb for two reasons. And I'll share something related to that that will kind of help explain why we will see a little bit of a slow impact. So it would be, sorry.
And Brad, Becca sent in a question that she was just asking, what was the modification to the Crozet Connect while you're working on that?
Yeah, I can share that as well. It's share my screen here. So going backwards on this PowerPoint, apologize, I don't know what happened there. I'm gonna blame Chip because he told me to send him my PowerPoint and he would actually run it for me. So I wasn't quite prepared for this. So what we expect to be happening is that right now we have a modified service for Crozet Connect. It's basically one route that's running. We have something very similar with our, what we call a 29 North Connect. The Livingston-Nelson County Connect is just the normal service. From Buckingham, we actually see that we need to actually double up the number of vehicles, mainly for the issue that I'll be sharing with you in the next slide that really will impact our trend of ridership. And that is with the restrictions related to social distancing and just the number of people that you can have in one space at a time, we are essentially having our capacity reduced almost by half. So this picture kind of shows you a schematic of a typical bus with about 18 seats, 18 places for people to be able to ride. Right now, we have, as the young lady mentioned, we have trash bags over our seats, pretty much in this kind of layout to prevent people from sitting next to each other. We're going to be moving to something a little bit less just kind of straps, more or less, something that's less odd with trash bags, but it forces people to set apart and keep their distance. But maintaining that means my capacity drops pretty much to 8 people. So pretty much in half. And if we look at overall, we're looking about a 40% drop from our typical ability to carry people. So what this means is even as ridership continues to grow and demand goes back up, as long as we are still maintaining some distances and limitations on who we can carry, we will not be able to carry as many people as we normally have in the past with the current fleet and resources that we have. And this doesn't matter with money or anything like that. It is just sheerly the number of vehicles that we have are all the vehicles we can put on the road, and that capacity is cut by creating these limitations. So we're going to try to make sure that we help our customers understand this dynamic and our partners as well, so that they're not misunderstanding when we say we don't have any space. We don't tend to say no a lot, and this pretty much means we will start to say no more as those ridership demands increase. So that gives you a kind of a sense of what we're kind of predicting and preparing for. Our ideas of when things will start to kind of tick back up are just like with Garland's. It's really time will tell, and we'll take it month at a time.
Brad and Garland, Becca was asking what the fares is right now. Are you all free right now, or has your fare changed?
I believe both of us are fare free right now for
Correct.
pretty much the same reasons, to limit the interactions.
Right.
Yeah, the state is still recommending at this point in time, until they basically until we get into phase 3, that all transit agencies still run fare free. That's part of what the COVID money is designed to do. It limits the interaction between the driver and the general public at the front door, and it also creates a model where we're not touching passes or changing hands or helping with money to to put into a fare box, which also is a source of potentially spreading the virus. So.
Okay, so that will go all the way through phase 2. Because we're in phase 1 right now, right?
We're in phase 1. If we can get into phase 3 and then feel comfortable, it would be a decision that we'd have to come to, city council and basically talk about, removing the emergency, which is where we got into the fare-free mode, and then allowing us to start charging again.
Okay, all right.
And
go ahead, Brad, I'm sorry.
well, I will add that yesterday, the governor announced that all public transportation will require masks. So Garland and I have already been discussing this, and our staff have been discussing a joint communication. Starting tomorrow is when it will be required. So this is going to be more than just simply requiring masks. There's a whole host of things that Garland and I have concerns about, limitations on civil liberties and just the sheer nature of leaving people behind if they don't have a mask. So there's a good amount of communication that needs to happen, not just with our potential riders, but also the public in general, to help prepare for this.
So one of the things that Brad.
Garland, I think you've frozen up. Well, I guess maybe he can call in at some point if we need to unfreeze, unfreeze Garland.
I'd say we've had many Zoom calls between Garland and myself. That would be the first time that has ever happened to Garland. That is
first time I got frozen. I was like, wait a minute. So we are we're trying to get a joint PSA out also. So the staffs are trying to work on. We've been going through PSA. We think they're very effective ways of communicating the use of the face mask. So our teams are working on that as we speak. Hopefully we'll be able to get that up early tomorrow. If not, then it'll be as soon as we can get an opportunity to do so. But yeah, I'm really concerned about the interaction between my operators and the general public if they don't want to wear it. It's an order by the governor. It's really being enforced, they say, by the health department. So we really don't know what that means, as opposed to, they really do not want us to call the police. They said that's not a civil interaction that they want to happen. So working through that, and I see Neil just got on. Maybe Neil can help give us a little more clarity on that.
Well, I don't know about clarity, but it's been 20 minutes since I've answered that question, though. So no, it is a very difficult task for all the transit systems with the mask, and I guess the best, we're encouraging obviously public information and webinar on the website, and you really don't want to put your driver into the enforcement agency situation, and so some systems may be handing some mask out, some don't see that as really their responsibilities, or having the driver do that or whatever. So I think in one case on fixed route, it's very difficult because you're just in a situation of what to do. And I mean, anything you can have the driver say, please next time wear a mask, and I know everybody's trying to do some social distancing on their seating. Demand response may be a little bit because you can remind them more often before they get on the trip. And I guess in some cases you could almost deny them in that situation, but it is going to be very difficult, and we've certainly fielded calls from all over the state here in the last 24 hours on that, and concerned, and so hopefully, well, I say hopefully, but that the people will get the message that they do need to have them, and again, it is an economic issue for some, whether they can find them, and also certainly, or get them in a volume that it's not too expensive. So, I wish I had a better response, because it is, again, the governor did say it's not a police enforced issue. It is the health department, and so how can you approach that? So I think it's hopefully that good manners, or help that you want to keep your neighbors safe will do it, but we've seen enough issues around the country right now where there is a part of the population that is not concerned about wearing masks. So, and I'm sure when the student body comes back, it'll be an issue, situation too. So.
Okay, great. Thank you, Neil. Does anybody else have any comments they want to make on this particular item?
Yes,
Madam
I
Chair.
did. I read in the paper that evidently Governor Northam is going to look at the legislature a little bit down the road for to be able to have civil penalties for people not wearing masks. So whether or not that happens, I don't know.
Okay. All right.
Madam Chair, it may be also, we neglected to include Becca White to give us an update of what the university system may be doing.
Oh, great.
Looking for the future.
So that's great. Becca?
Thank you. So really the only things I'll add, I mean, just like the other, just like all the services, we've had to alter our routes. We're down to, they were on and off from March 23rd to now, suspending nearly all of our routes except for the ones that support the hospital commuter parkers. Once all the students were out of the dorms, a commuter route is the only one that we're running. And if you're interested in what services we're running, it's all published online. But to add to the conversation about protocols and loading and rider's guides and such, we have backdoor loading, which I think most properties do now. We have a barrier in the aisle between the passengers and the driver to sustain a 6-foot distance. I think most people have that too. Our cleaning protocols, just like Kat described and Garland described, not only the deep cleaning every night, not only the fogger, but a midday high touch wipe down. So I think I don't say it to repeat it. I say it to enforce that Garland, what he's describing is the industry standard. And that's what we're all doing. We have published a COVID-19 rider's guide. We have been able to mandate masks. We're moving about 900 people a day, approaching 1,200 a day this week. And the hospital will be back to full staff probably by August, in which case we'll be moving over 2,000 people a day. Masks are mandatory, and we have had zero issue with that. At the UVA's return to school announcements, I'm sure you've been following it in the press. No later than Monday, the UVA will announce what's going to happen regarding the third summer session that was supposed to start in mid-July. And no later than June 15th, UVA will make announcements about the fall semester, which is supposed to start on August 25th. President Ryan put out something today that I'm sure will be all over the press about that August 25th decision and the conditions under which that'll happen. But I think that's all my updates. But we have been, just like everybody, we've got stickers on the seats. I guess the only thing I'd add to that conversation is that we have had to have proactive loaders on the buses to be sure that we don't load past the loading limit. And like you said, the capacity is cut by more than 50%. It's cut by about 60%. And so this becomes a very major thing for mass transit to have its capacity cut by 60%. And this is a very, very, very big problem that we're going to have to deal with in terms of priorities on what is mass transit when you're limited to so few people on the bus, and how do you keep everybody safe and sound, and what are the risks are very, very high for an exposure being traced back to public transit. So I just echo what my beloved colleagues Brad and Garland said. So it's very, very similar, some unique aspects, just like all of us have unique. So hopefully that's a helpful update.
Thank you, Becca. That's very helpful. Are there any other comments or questions?
I do have one other comment, Diantha, if I.
Okay, sure.
Beginning June 1st, CAT will put more service back on the 5, the 7, and add an additional trolley. I think we'll help with that because we're still running our Lifeline service, which means we're limiting the capacity on our buses to 10 passengers at a time. That was a recommendation from the state. So we're still following those guidelines, but we think as we're transitioning from stay at home to safer at home, more people are venturing out and using public transportation to go to work. So we're putting a little bit more service out there. We're trying to be, trying to change and adjust our service to meet the needs of the community, but also watch out for, the safety of everybody involved.
All right, so just for clarification, 5 is the route that goes?
Route 5 is the Commonwealth Drive bus that goes Fashion Square Mall, Barracks Road Shopping Center, Ryle Hill Shopping Center. That's the one. The shop at Stonefield.
Right. Okay. And then 7 you mentioned? You said 5 and 7, I thought.
5, 7 in the trolley.
And 7 is what?
That's Emmett and Seminole Trail. That's Fashion Square. That's the shops at Stonefield. That's Seminole Square Shopping Center. That's Barracks Road Shopping Center. Gets the UVA campus, and also downtown transit center.
Okay, great. All right. And Jim Foley had a question. So Jim?
Yeah, Garland, have you finalized your plans regarding school and riders, and how many students will be allowed on your buses, and what precautions you're going to take on the school routes? Because we're still working on it. And our decision, we're going to follow CDC guidelines. So
correct. We're trying to. We actually Sherry had a meeting. An additional call must have been Tuesday. And they're still trying to finalize what the potential model could look like. There's some issues concerning whether we're potentially going to split kind of the bell and split the days, kind of rotate the kids 1 week on, 1 week off, or do it by families. So there's a lot of discussions that are going on right now. We're just trying to figure out what makes sense because, we do have limited drivers, we have limited vehicles. We still need to get them at a reasonable time to the school so they can have the school day start and then end at a certain amount of time. So there's a lot to the logistics to be going through, and we're having, we'll have another call, I believe it's Tuesday of next week to kind of go through that also. So stay tuned. If you know anything that works better, then please let me know.
no, we're going through the same thing. So, for example, a bus that might have a capacity of 77 elementary students is now going to be 12. So
correct.
That changes days kids can go to school and bell schedules and everything.
Like a transit bus. Yeah, you really do have to limit them because you got to really you're really talking about putting one kid in every seat and then having them kind of one to the window and one to the aisle to try to get the spacing. That's really what's in my mind. I mean, we may even do less than that, maybe every other seat to make sure you get the 6 feet spacing distance. So yeah, there's a lot to be worked through over the next couple of weeks, next month.
Hey, I feel better now.
Is that misery loves company? Is that what you're saying?
Misery loves company.
Okay. All right. So with that, let's move on to, if you don't mind, to the 2021 budget updates around the CARES funding, the CARES Act funding. And we have reports again from CAT, JAUNT, and Rideshare. So I guess, Garland, CAT's listed first on the agenda. So you want to take it away?
Sure. If Chip, will you put up the slides?
I think we can do that.
Perfect. So I sent Chip 2 slides to kind of just give a high overview. I can talk in more detail about any of the particular categories if anybody would like to. But as soon as we get that up there.
Here it comes. It's coming.
You're going too fast.
There we go. Perfect. Thank you. So the CARES Act, which stands for Corona Aid, Relief, and Economic Security Act of 2020, gave $7.14358 million to this region, and it gets split between CAT and JAUNT as being in the small urban category. Of that money, we can use it in FY20, which is this current fiscal year. We actually can go back to January of this year for expenses related to COVID. The funds must be used on COVID-related items. So anything related to operating, capital, planning expenses, loss of revenue, are retroactive to January. So we're working through that plan, and actually we worked through the planning process with Albemarle County and with the city. And on the next slide, you will see kind of the high-level categories of what CAT was. Whoa, what happened?
Yeah. Formatting.
Nope, I blame Chip again.
Yeah.
Can you let me see. I can do it on my screen. If you okay. Let me share. I believe I can still do it from here. Share the screen. Hopefully.
I'm just going to say misery loves company. Now I know how
there
people...
you go. That's the name of the game today, right?
I don't even see a thing for sharing the screen now. Interesting. Anyway, here we go. Can you see it?
It's coming.
All right.
There we go.
Perfect. So in the top area, there's basically 6 categories by which, and I'm going to start on the right-hand side where the category it says revenue loss. So based on the activities that we've done and followed and recommendations from the feds and the state to kind of do rear door boarding, we are not collecting fares. We're running fare free. So our ridership is down, our advertising revenue is down, and we're not collecting any fares. So that is one of the allowable resources for us. So we are putting back about $767,000 estimated between the 2 fiscal years in revenue loss. There are additional operating expenses that CAT is incurring because we're doing additional cleaning, buying PPEs, we're running PSAs. That number between the 2 fiscal years is about $373,000. The majority of that is on the cleaning side. I just want to make sure everybody's aware in the PPE. The PSAs is a very small portion of it. I think it's only $20,000 over the 2 fiscal years. And then if you look at it says remove FY21 proposed funding increase. That is because both jurisdictions, the city and Albemarle County, basically are funding CAT at FY20 levels based on FY21 projections of having an increase. That gap funding is $760,000 between the 2 jurisdictions. There's also a capital loss, small portion, because the state is still working through their numbers. And actually in working with my transit manager, Mike Mucha, There are certain items that are in my capital expense project plan that I probably can pay for out of the CARES money, which are small support vehicles. Some of that is in that, and then we're buying some additional protective gear, some they're called driver protective covers. It's a pretty expensive item. It's about $210,000 to fit all of our vehicles to provide another for all of our drivers to protect. There was a contingency of about $877,000, and that was just designed because as things are so fluid and changing, we wanted to be able to adjust to anything that comes our way, whether it was additional personnel or we had to additional revenue loss, because the revenue loss projection there is not the full figure, because we estimated being able to run fares a portion of the year, but if that doesn't happen, then a portion of that will be covered. And there's also personnel costs. Now, we're being very conservative on the personnel side, to be honest, because of how many high risk individuals that CAT has on our payroll. We have a lot of individuals that are basically doing reduced schedules or sitting out. We're still, by CARES Act, we're paying them to keep them safe. CAT is okay, the city's okay with that, the process. This is a legitimate way to pay them and make sure everybody, so when it's time that we can turn it back on, we do have our staff to turn the service back on. So these, and if you add all that up, it basically spends pretty quickly the $5.3 million. And we're hoping that we can stay within our budget between this and the potential fallout for another second round of COVID that potentially happens in the fall.
Okay. All right. Brad, you want to take yours for JAUNT?
Yep. Let me, because I am not going to rely on Chip.
I thought maybe you were going to show yourself upside down again.
I didn't do that. That's right. That was going to be my intro. That, yeah, my budget is definitely up. Let me. My budget is definitely a bit upside down these days. I don't quite have numbers to share as much as I wanted to share kind of the concept of what is happening mainly to JAUNT's budget that is causing it to have some difficulty in articulating exactly what the impacts will be, and especially how the CARES Act funding is being used. So at the core of JAUNT's financial sustainability has been this coordination model, to where we operate a number of vehicles, and in this case, we'll just talk about one, and we put multiple types of passengers on that same vehicle to maximize its efficiency. What that is we've got arrangements with like PACE, the Program for All-Encompassing Care of the Elderly. We've got contracts for providing like Medicaid, non-emergency medical transportation services, JABA, other human service agencies that we work with that pay us a fully allocated cost, meaning they pay the full cost of their share of the operation of the vehicle. So in the example that is before you, it's taking an 18-passenger vehicle and shows that if there are 13 public people and 5 quote-unquote agency, that and it does not cost $100 to operate my bus, but it's an easy number to share to explain how the cost gets split up. But if you look at if the bus costs $100 an hour to run, the amount that we ask for or assign to the public expense is $73, and then the agency side is expecting to cover $27 of that. So this model essentially avoids or offsets the cost to the public by $27, because what happens when we're faced with the impact of COVID is we've lost all of our agency services. So where we were filling in these seats we now don't have those trips. Now, keep in mind, these buses, the way we've been coordinating services is carrying people of all different types and purposes from one common area to another. So we can't fill these seats by running them around any further than they've already been scheduled to do. So what happens is those seats become vacant. And in this case, those 13 public people are still riding. The cost is still $100. Now that full cost is being assigned to the public side. That, hopefully in a nutshell, helps understand how we're facing this loss of agency revenues, but also the expenses that were once covered by those revenues are now being felt by the quote unquote public side. That is really a focus of where the CARES Act funding is going, is to help offset that impact. And so in kind of summary, it's we've got this loss of public fares like Garland has with his system, but our agency revenues, which to amount to anywhere from $1 million to $1.4 million, are going away. A lot of those revenues that go beyond just paying for the agency share becomes excess money that then goes to help the public transit service, which is a whole nother diagram that I didn't put together. But we are able to take those funds and shift them over to help. That's going away. And then the cost, like I said, that $27 is now being shifted over to the public side. In addition, we've got the mitigation and prevention expenses that both JAUNT and CAT will most likely experience at the very least for the next year, if not longer. So in summary, that's what we're faced with. We have a range that we've put together for FY20 to get a sense of how this impact has been. We're still trying to get our hands around FY21. That's largely related to how these agencies like PACE and JABA and others will start to re-engage their patrons and their clients, and how we play a role in that. Our early conversations indicate that there might be a desire for separation, which is not easy for us to do because it goes against that core coordination model. So we're pretty much faced with that. As we're moving into closer and closer to FY21, we'll have a better sense of what we should try to estimate as far as our expenses. And like many, we're going to be playing it month at a time and just adjusting accordingly as things are changing and we know what our revenues are as well as what expenditures we have in order to still meet the demands that are there. That's all I have. If there was any questions about that, be happy to entertain those.
I guess, are there any questions about Brad's or Garland's? And if not, I don't see anything on the chat. So if not, then I think, Sarah, you were going to report out about rideshare.
Yes. Yes, mine will be nice and quick. Rideshare, most of our funding, as you guys are aware, 80% comes from DRPT from the state, and then 20% is a local match from the localities. We have readjusted the last portion, so the last quarter and a smidge of our FY20 funds to reduce some costs based on some programming we were not able to do. I think last time when we met in February, I mentioned that there was going to be a coordinated bike event for Bike Month. In May, also May is Clean Commute Month. So all of that public programming was not happening. So DRPT has been kind enough to let us take those types of funds and roll them over to FY21. So that is the biggest update on our budget. We are in the process of working with DRPT to file for that grant extension and to make that rollover process happen as the year comes to a close on June 30th. So that's the only main update I have, other than our programming has focused more towards telework, since that is the safe and CDC recommended way for folks to conduct work when possible. All of our other services are still available for folks who do have to use that option as their only option, but the main focus has been working on telework, developing strategies that we can then share with employers for having formal telework programs as people are returning back to work later this year.
Okay, thank you. Any questions about that for Sarah, for rideshare?
If I could just add to that, is that One of the concerns that we do have, though, is that though DRPT is allowing us to move the unexpended funds from FY20 into FY21, we're still concerned that when the General Assembly goes back into session for a special session, probably in August, they will be looking for any state funds that, to reprioritize. I was just on a call with the Virginia Association of Counties earlier this afternoon, where there were 2 delegates and a state senator, and all 3 talked about that special session, and they all 3 made the comments that as devoted as they are to funding the needed transportation needs around the Commonwealth, health and safety and replacement of revenues will take a priority probably over their transportation funding. So I have a real concern of what may happen to some of our normal funding streams coming from the state for next fiscal year.
Okay, well, certainly their revenues are going to be decreased just if you look at the lack of gas monies coming in and miles traveled. Having said all that, any other questions or comments? Or all right, so Chip, the next item on our agenda is the appointment of the Finance and Budget Committee. Do you want to put this a little bit in context for us?
Yes, if I can. And since we even developed the agenda, we've had some conversations with Albemarle County staff and other staff members. And so we have a little bit even different of a concept. But to give you the historical background, there was an executive/finance committee created probably a year and a half ago that helped to create the memorandum of understanding between the City of Charlottesville and Albemarle County, trying to create a more formal funding process during the annual budget time. The MOU was adopted, some refinements were made to the funding formula that has been used for quite a while. And that committee worked that through over a several month process. After using it for this first year, we found that there are some areas in there that we probably need to modify and not so much correct, but to make better, and then to provide an ongoing mechanism to review both the financial amounts as well as the ridership data. And thought that one of the ways to do that would be with the resurgence of that Finance Executive Committee. In some further discussions, rather than having to use that committee to get down into the details of it, I'd rather recommend that a technical committee of CAT, the City of Charlottesville, Albemarle County, and the PDC that would include both executive level administration, finance and budget folks, and of course the transit staff that would meet on a more regular basis. Then they would come back with information probably on a quarterly basis to the RTP's Finance and Executive Committee. The Finance Executive Committee before was made up of, I think at the time it was the chair and vice chair, so that there was representation from both the city and the county at the elected level. Whether it's the chair and vice chair, I still, I think it's mandatory that you would still have an elected representative from both entities, but it would be on that higher level Finance Executive Committee. And like I said, they would probably hear from the technical committee and get together maybe quarterly for that.
Okay, because this is a little bit of a change than what we have on the agenda. So I just want to make sure I understand. The recommendation is, and everybody else understands as well, the recommendation is that we establish a technical committee that would be reporting to a finance and budget committee? I'm confused, I guess.
Yeah, it would, yes, I mean, that would be it. So it would be that the real details of the work would happen with staff so that, you know, we could meet as regular as needed, hash out the details, and then prior to bringing that information to the full RTP, bring it first to the Finance Executive Committee.
Okay.
And because some of this will, as you remember from the prior meetings, if it were brought straight to the RTP, it would engulf the entire RTP meeting every month.
Right.
So probably on about a quarterly basis, the technical committee would bring this information to the smaller group, who then could either provide direction or bring it to the regional transit partnership again for information.
All right, are there any comments about this? Because I think, Chip, it's going to be important for the minutes that we understand who's going to be on the technical committee, perhaps, and the finance and budget committee. Or do you want to bring us back those names at a later date? Or
I think that if this concept sounds correct, we'll bring you a recommended list at next month's meeting.
Right.
And from the technical side, the staff members can go ahead and start kind of getting organized with it, and then have you finalize the actual makeup at your next meeting.
is that acceptable to every, does anybody want to make any comments, or does that work for everybody? I don't think at this point we actually need a vote on this.
No.
We just need consensus to move forward in that direction, I think. Lloyd, looks like you have something.
It sounds reasonable to me.
Okay.
I have no more elaborate thought than that.
To me as well. So does that work for everybody then? Are there nodding of the heads or?
Yeah, ditto.
Yeah, okay. All right. Then I think, Chip, I don't see anyone else that wants to make any comments. So if we could have, you all could begin the work with the technical group, and then we'll see the details of both of these groups at the next meeting in
Yes, ma'am.
Okay. All right. So with that, then let's move on to the CARES Act Rural 5311 funding. And I'm not sure who's presenting. Chip, are you?
Well, I just wanted to make the partnership aware that through some discussions, I think both with you, Diantha, and with Supervisor Galloway, who became aware of this through the MPO as well, that with the CARES Act funding, the Commonwealth Transportation Board divided the rural funding up, the 5311 funding, which for our region includes funding to both JAUNT and CAT. So this isn't the urban funding, but just rural funding, and divided it with 50% of the funds that came to Virginia was divided among the rural transit providers across the Commonwealth. 15% of that was earmarked for the Virginia Breeze system. And then the balance of 35% was put into a what I would call a discretionary pot for the director of DRPT to use. I'm trying to think of the terminology, but it was for critical needs that would come up in the future. And the question was raised, and a letter was sent to DRPT just asking, trying to define kind of what critical needs are and how local agencies could be considered for that funding. So we just wanted to include that letter in the packet and let people know that that inquiry was made. But to my understanding, I don't think we've heard back yet.
I have not heard back, and I will say to the board members that we did have a copy of the letter. It was that May 15th letter that was in your board packet that I signed off on the transit partnerships I have. Neil, do you have any comment about this, or we haven't heard anything back? It was addressed to Jennifer Mitchell.
Yes, I mean, I've seen the letter and staff has talked about it, and so there is a reply being drafted. But just to give you some background, for the reasoning or the planning of this is that what we did as an agency is and this is sort of working with what the secretary is to keep maintaining operations as best as we could. And so what we did is look at the 5311 systems and try to predict with the first CARES of what their over a 12-month period what their operating needs were be, and that certainly was based on last year's operating, and so they received that for the CARES money. And then the 15% for the Virginia Breeze are actually it's actually a requirement to use for intercity bus is 15%. It's always 15% of either the 5311 annual funds or whatever. So it's what we use for the Virginia Breeze now. So to not use that, we'd have to go out and do a study to show why our needs weren't needed for that. But since we are starting 2 more routes, we felt it was. And so the reason for that, I believe some of the reserve is to, again, we expect that it'll go to the 5311 recipients, but we want to see, and we've had discussions with some of the grantees of the amount that we gave them. Is that enough for 12 months or not? But we wanted to get the first grants or contracts out to them, so in a 3-4 month period we can see what their invoices are looking like and their expenditures, and then decide whether some are needed to have more, some may not, but we need to go, we needed to go this route first. I've already had discussion, Brad and I've had discussions, obviously, with John taking over Greene County, how that's going to work in the long run, whether it be more expenses needed. And so I guess part of it is that the DRBT is a recipient of the 5311 funding. And so we had to work with FDA in a quick manner to execute. And we felt that we wanted to get a good portion of it out. And then I think that you'll probably find that the reserve will be, well, for the most part, will be, we'll get back to the 5311 recipients throughout the state. Hopefully for operating to can keep their existing operations, or whether there are some capital needs that go on.
Okay, any questions, Brad, or from anybody? I guess what I'm hearing you say then, Neil, is that you all are working on a response to the letter.
All right.
And we'll be getting something shortly that we can share with RTP members.
Yeah.
Okay. And it looks like your timeline is maybe 3 months, 4 months.
Well, I mean, looking at, looking at what we did for operating, some have decided to use if we're still in FY20, and some have decided to use their 5311 for this year and won't get into the CARES until July 1. Others have decided to immediately start using their CARES. So we need to balance that situation out to see what everybody's going to be doing. And so, certainly we've had a few invoices already come in, and we certainly have, monitoring what their expenses are and things of losses and things. And so we will certainly go through the process here in the next few months to see if we can get an idea of if some of the systems aren't going to make it to 12 months, then we need to add to that and then decide how we will use the rest of the CARES funding. There is no end date on the CARES funding. So, we do have some flexibility. We're not sort of keeping in reserve just for things that the director is going to think of or anything of that sort.
Well,
if I could add, just for people to understand the difference between the urban federal money that comes through CAT and then this rural money that comes through the state. There is a kind of direct correlation to what's spent versus what's being like what reimbursement you ask for from the state when it comes to this rural money. So while there is money that we can show what our expenditures and all will be, it comes down to what is actually spent that gets reimbursed for. It's a very similar thing to the urban money, but the urban money is pretty much defined fully up front, and then you're kind of figuring out how you're spending it as you go along, versus the rural kind of, it's more articulated as you start spending the funds. So in a traditional setting or typical setting, those federal urban funds are designated up front and we're using them. The rural funds are a 50-50 match. And so we can't draw them down unless we spent the match or have the match and spent the funds. So if I spend $1, then I can draw down 50 cents. That's not the case here. We spend $1, we can draw down $1, but it is still a reimbursed basis versus kind of having a good sense of how much you have in the pot up front. Hopefully that makes some sense.
Yeah, the urban funds, or the CARES urban funds this time, normally our 5307, like you say, is, we just get it and we can do what we need to. But on the CARES side, it's similar to what you're doing on the 5311 side. I have to have the expense to match on that side.
Yeah. I guess what I was trying to articulate was we know what the max amount is on our urban side versus the rural. We could go after as much as we want and be aggressive about identifying how much we need. And that's my plan. And Neil and I chatted about this, is making sure that we've got a good sense of what we need and approaching DRPT to say, hey, we need some more of that pot. But that's what I meant to say, is that urban is a little bit more defined as far as the max, or rural is a little bit more open-ended. It's a good and bad thing. Depends on how lenient DRPT is with giving us more money.
Okay, just a comment, and this is just a comment from me, whether it's federal dollars or state dollars, I get very concerned you use it or you lose it. And so when I hear there's no ending deadline, I feel like, wait, hold on. Because anything that sits very long somehow or another manages to disappear. Just a comment. So anybody else have anything they want to say? Or
I would say, Diane, that we are not going to give any money back.
you know what I'm saying, though. I mean, I just get very worried. Okay.
We're gonna do what we do within the letters of the law, but we're gonna spend it in all those categories to make sure we can take care of it, move it along.
Yeah.
And I wanted to say that I agree with you, because we don't trust the federal government, but yes, I agree with you.
Well, it's just the way the things, when money gets tight and everybody starts looking around for where there's money, and it's not being terribly critical of anybody, just simply saying that seems to be what happens. Okay, if we're ready to move on, I'm keeping an eye on the clock then. The scary part of this agenda was the next agenda item, which was many long. So I'm going to turn this one over to Chip. This is the tip and the step. Anyway.
To be honest, the tip and step can and should be a scary item. It's a very complicated system. I'm not going to try at all to go into detail with that today. I think it's for one of our workshops. We may want to try to set aside some extra time to get into the details of exactly what the Transportation Improvement Program and the State Transportation Improvement Program does. But just very high level, you all are familiar with the planning process CAT does a strategic plan now. JAUNT does their transportation demand plan. From a roads and bridges standpoint, as well as bicycle, pedestrian, and transit, our MPO area has to do a regional transportation plan every 5 years. And this plan helps to project what projects we are in need of. Once those projects are funded with federal money, then they go into what is called the Transportation Improvement Program, or the TIP, in the local level. And so I just included the whole document in your packet, but I would just ask you to pay close attention to pages 27 through 38, which has our urban area, the MPO areas, transit needs. These are projects that have been funded. They have some type of federal money involved with those, so they're listed here. And why this document is so important is for some of these projects, such as maybe a multiple bus purchase, those funds will come out over a several year period. And so this document helps to say, if we're going to be spending $1 million on buses, we may be spending $300,000 in fiscal year 21, $600,000 in fiscal year 22, and then another $100,000 in fiscal year 23. It breaks it down into what years we'll be asking the state and in turn the federal government for that money. That's what this document does. We haven't, as an MPO, spent a lot of time on this in the past. It's been kind of a rubber stamp approval process, and it shouldn't be.
Right.
And so we're really trying to do a better job, both with the RTP and the MPO Policy Board, of building an understanding of why this is so important, and then providing a very routine and regular update. Because the other thing that happens is if the money is not spent in one of those years, an amendment has to be made so that it goes into another year.
Right.
The other thing that happens is even after the money has been spent, and I'll use a very large project, the proposed bypass that had been talked about and property had been acquired, that has to stay on the books in the TIP just to close it out, even though it was a project that didn't move forward because money was spent acquiring properties, and then those properties were resold back to the original owners. Those type of projects have to stay in this TIP the entire process until it's closed out in its entirety. So I just have it there. This is a way to begin to introduce it to you, but I think during a workshop, we'll try to maybe spend half of a meeting just on this.
I think that would be great because I'd love to understand it better, but it's going to take a little bit more than just the time we have this meeting. And when we have the work session and a discussion in a work session, we can concentrate on how it impacts us, which is what you were talking about, where you go to the CAT and the JAUNT summary so that would be very good. And how it intersects with the MPO, and so that'd be great.
And the MPO is mandated to adopt the TIP and the amendments. Those are then forwarded up to the state level where the STIP is adopted by the Commonwealth Transportation Board.
Okay. All right. Hearing no other
Diantha, I had a question for Chip.
Sure.
Chip, is it possible to put a footnote in CAT and JAUNT summary pages to indicate that the CARES Act funding is not included? Just so that nobody looks at those numbers and gets confused that, the urban money or the rural money, whatever. And I don't know if we'll ever update the TIP to reflect that, but at least at this point, it would be nice to make sure that there isn't any of that confusion.
If you wouldn't mind sending me kind of the wording you think would be appropriate, we can do that with no problem.
This is why no one speaks up about things, because then they get work to do. Yeah, that's fine. I'll send you something.
All right.
I figured. Thanks. We'll do that.
Great. Then let's move on in an effort to try and get some of these updates in. I'm not sure who's doing Virginia Breeze. Is that you, Chip?
Yes. Matter of fact, I'll just run through all of these very quickly.
Okay, great.
Just to let you know, and they have been having discussions with JAUNT, CAT, and the University Transit System. The Virginia Breeze, and Neil, please correct me if I misstep on any of this, but the Virginia Breeze system that will be running from Danville to Dulles and Union Station has been awarded. A subsidiary, I think, of Megabus was the awarded transit provider. Yeah. And we've been working with them on finding appropriate stops in the Charlottesville area. The discussions right now, while the initial thought was that the Amtrak station would be a very appropriate stop, one of the problems that we've run into is it takes so long to get off of 29, come through town, and get back to 29 that it throws the timing of the system off. So we're trying to find, and it needs to have direct connections to both CAT and UTS. So they've been working on other locations that are probably somewhere on the 29 Emmett Street, Barracks Road area, but could also be right on the edge of that, as long as it can have that UTS and CAT interconnectivity. And it should, I was going to say, it was expected to start fairly soon. With COVID, I'm not sure if they really have a starting date yet, but at least they have awarded the contract.
Okay. After the
I'd just like to add, just to back what Chip says, we do want to thank all Charlottesville and UVA and JAUNT to provide us a lot of assistance in looking at the sites. And our goal right now is trying to start service in August, and with a few weeks ahead of the university starting. And my staff is working, pretty heavily on that process to get the stops all across the service, and the goal is to be running for like 2 weeks before a lot of the universities along in Virginia are starting. So we'll just have some idea how the service is running, and so we will be in July, if August is our starting date, working with a lot of the Charlottesville community on marketing and the service and schedules and things of that sort. So
Okay.
we are very excited, but we are watching what the universities are doing very closely also. So.
Okay. How about the Afton Express?
Okay. And we will very likely ask our partners over across the mountain to come in and present on this as it gets a little bit closer. But they're moving forward and have already engaged a marketing firm to begin to develop a logo and a marketing campaign, very similar to what Neil said the state will be doing with the Virginia Breeze, so that the system can begin to be marketed before it starts to provide services, trying to build a customer base ahead of when the actual services will begin. We've presented this to you several times of how those routes will be. It does include both Charlottesville and Albemarle County stops, and expect that project to continue to move forward. The next two are a little bit close. We did submit grant applications, one on behalf of asking for funds for a study to look at expanding service in Albemarle County in the Monticello, the Pantops, and the Route 29 North corridors. They have been submitted. Albemarle County in their budget has the match provided and approved. The downside of this, number one, we're hoping that it scores high enough and is awarded through DRPT, but we've also been told that instead of having a June award, that will likely occur in September or October for their technical assistance grants. And part of this has a lot to do with what I spoke of earlier. They need to see what the General Assembly does with the budget coming up.
With that August session, I guess is what you're talking about.
Yes, they don't want to make awards and commitments and then not have the money to honor those commitments. And that is the same thing with the Albemarle County, with the Regional Transit Visioning Plan. We submitted that. We submitted a request of roughly $550,000 or $70,000. in some discussions with DRPT, we decided to scale that down to make it a little bit more manageable to a total budget of $350,000. And it's my understanding right now that the local portions of those matches, both Albemarle County and the City of Charlottesville have approved that. So should it get awarded, we would have the ability to move forward on both of those.
And that's really good news for our community, to be honest with you. So this is great. Thank you very much.
I have said to a number of people, especially that regional visioning plan, though a plan like that will take probably 18 months or more to complete, I still think coming on the heels of the COVID changes, it will be able to provide a really good direction for the long-term future. Really hoping that gets awarded. The final was a grant application, and Jessica, I haven't had the opportunity here to say what a great job you did. Applying straight to, I think this was for Federal Transit Administration, but it was a federal grant application. We've applied for just over $700,000 to do a small area planning and site planning, kind of master planning for the Amtrak station area, to try to figure out how that property could be reused for both its current uses, but be able to expand to meet the expected growth with the Amtrak service, especially if the additional train is put into service. We've had some further discussions who have said while the Long Bridge is still a major pinch point for being able to add that line, that it's possible that service may be able to be started before the Long Bridge is improved. And so we hope to hear something back before November of whether that project will be awarded or not. And this would be a very large community engagement process of how that site could be reutilized, keeping the same uses, but also meeting community needs.
That's pretty exciting. Any comments or questions about these updates as we've been going through them? Is anyone? So
the only thing,
yeah, go ahead.
If I could add, just if anyone is kind of interested in exactly what we're talking about with the Amtrak station, Raleigh, North Carolina received one of these planning grants a number of years ago that led to the community engagement, the design of their Amtrak station. They then used that to get a construction grant, and they now have a very nice multi-use, both residential and commercial development at their Amtrak station in Raleigh. And that's a really good end product somebody can look at for what we're trying to do with this process.
And my only question would be, or comment would be, that I would hope that the economic development folks from both sides of the city and the county would be involved in this work.
It will be a very large stakeholder group.
Yeah. Okay, good. That's great. Any other thoughts or comments? I look forward to hearing more about that one. Okay, then transit service providers. Let's see if we can go through our usual updates and see if anybody else has anything additional. Garland, you want to start with CAT updates? You may have covered all of them, but if not, this is your chance.
I only had one other thing. I should have brought it up when we were talking about their ridership, but I actually have I'll send it out to everybody as opposed to just prolonging our meeting here, but it will show our ridership over the last 6 years. It's our ridership trend for the last 6 years. Otherwise, we're plugging along, and It's a new day every day at CAT. We're adjusting to the COVID-19 pandemic as best we can, trying to keep everybody safe, trying to make sure that we provide the level of service that the community wants and needs, but also balance the need to keep our operators safe before we have anything that pops up. We are paying close attention to what's happening 70 miles down the road in Richmond. Some of their operators are coming down, they are getting COVID. So we want to make sure we don't have that here.
Okay, Brad, Jaunt?
Garland didn't mention that we've had many conversations over the last couple of months. So our communication has really ticked up quite a bit. Some of it's related to COVID, but it's a lot of it's just related to sharing budget conversations, just future plans, just conversations. And I believe Garland, myself, and Chip will start to try to have some regular conversations to keep those dialogues going. So it's been really great. I think we've covered quite a bit in just a short period of time. JAUNT is, Neil kind of stole my thunder. Come July 1, JAUNT is going to be assuming the services of Greene County Transit. So we're bringing them into the JAUNT fold. They'll still have their own identity. Yeah, we're diving into that. And I believe that in a short period of time, we should see some planning going into a connection between Greene County and Charlottesville. Chip, through some of his planning efforts, had identified at one time that there is a good number of people going from Charlottesville to Greene County for work. So that commuting need is both ways. And of course, anybody who drives on 29 in the morning under regular conditions knows that there's a need for some sort of extended commuter connection. The only other update I have is JAUNT applied for a FTA grant. It's called Accelerating Innovation and Mobility. Some of you heard me talk about this on-demand and mobility platform that we've been exploring to implement. We decided to go after this grant to help fund that initiative. I'll keep you all updated. Once we're able to summarize the grant application into something more simplified, I'll share it with y'all. It focuses initially on food security, loaves and fishes at first, but even after a phone call today with Rich Schuyler with the Network to Work, there's clearly a need to create a platform to help kind of bring that synergy to the transportation choices that are out there to help kind of enable some of these connections. So I'll share more of that later on, but that's mainly it from JAUNT.
And I just would add to that, it's loaves and fishes, but it's also that Lambs Lane campus, the school complex that's located right there, as well as some of the areas around. But that's an exciting on-demand pilot for us, and we're really excited. When will you hear about that grant?
I'm not sure. Fortunately, they did get as many applications. Unfortunately, they still got like 75. So they still have to go through a lot of those. Yeah. It could be September, what we hear right now, that we might hear something. And I should mention that Garland's made this comment a couple of times in different meetings about shifting CAT services around this demand response kind of synergy. And this relates to that in a way that instead of CAT trying to dip into so many neighborhoods or trying to serve the suburban model, looking at ways of bringing people to more of those centralized hubs instead of expending those resources on CAT's side. Garland and I plan on chatting more about those kind of things, but there is that kind of relationship that it could have.
That's excellent news. Good to hear. And then we're on to UT House. Becca.
I just wanted to say again, great to see everybody. I have nothing further to add.
Okay, and then Albemarle County Public Schools, Jim.
Well, I hope I look as credible as Brad, even though I don't have a tie on. I'm thinking maybe Brad has his shorts on, but you don't have to move your camera, Brad.
I even had colorful socks on.
Yeah, figuring out the school schedule's three-dimensional chess right now. So we have some guidance from CDC, but VDOE really hasn't come out with anything yet. And and we're kind of looking to them for a little bit of guidance. But you know, I hope to bring my 12-month staff back sometime in June, and then we're looking at doing some other things starting in July, but none of that's been finalized yet. So we're still working on it. It's again, it's a huge capacity issue because we're going from, you know, 50 or 70 students on a bus to 12. So it's a challenge, but we'll figure it out.
And I will just mention one thing, because I know we've talked about this in the past, but at one point you guys were on a committee working together to talk about drivers and driver wages. That's JAUNT and CAT and the public schools. And I hope at some point that committee could get back together. I know we talked about getting that committee back together and seeing just what you all might be able to work out as far as improving that synergy.
Yeah, I'd like to keep that effort going. And I know next year we're planning on a wage freeze. So
yeah, so I think that would be good. I know I've talked to Chip about that as well. So maybe Chip, just pinging the folks that need to be on that committee and having a restart on those meetings would be helpful.
Did that.
Yeah, okay.
that's all I have.
Okay, great. Thank you, Jim. And then we would normally have a CAT advisory board update, but I don't think there's anyone on the meeting from the CAT advisory board right now.
Diane, I am technically on the CAT advisory
good.
board. There has not been a meeting. In fact, I'm not sure that there are more than maybe 1 or 2 members of it. So it's got to be repopulated, and then it'll have to meet.
Okay, let me just ask a quick question, because we were seeing at one point drafts of the bylaws. That committee advisory board was working on new bylaws. Do you know if City Council has approved those new bylaws yet?
Certainly not during the last 5 months I've been on council.
Okay.
My recollection is that at a meeting back in February, when I raised the question of, you know, what's happening with the CAT advisory board, there was a gentleman who apparently thought of himself as the sole instance of continuity between years past and the present, who was, and I wish I could remember his name. I don't mean to be dismissive in that way. I just don't remember his name. Who talked about the fact that we needed to designate some new members. Those, as I understand it, have to be appointed by council. Council has not appointed any new members. We have a request, an advertisement going out, again, talking about here are the various new members of new boards that need to be appointed. I think the CAT advisory board is one of those being advertised, but I haven't seen any action, any motion on it at all. Garland, have you seen anything on that?
I think we passed those by presented. I don't remember the date.
It would be, because I think it'd be they have been approved by City Council, or just a copy of those final bylaws to come back to our partnership so we could take a look at them. I have a couple of people in the county who have indicated to me an interest to be on this board, you know, on your advisory board, users of CAT. So how is that going?
So the gentleman's name was James Mann.
Yes.
Mr. Mann has expressed to the city that he's got other avenues that he's going to follow. So he's not going to reapply to be on the CAT advisory board this time. One of the conversations that I had, one of the last conversations I had with him was that the reconstituted CAT advisory board needs to adopt the bylaws.
Okay.
That group is up and running. They need to adopt, and then we can move forward. Is that what you remember, Mayor Walker?
It's vague, but someone did present the minutes to us, and I can have that information update next meeting. But I know they've been presented to us.
Yes, I think they have been presented to the.
And so I just have to figure out if we voted on it or if it was coming back before the later date.
I think the last time, and you know, like you said, we'll have to look through it, but I thought it was, James Mann said that it was more informational piece to council as opposed to asking council to approve it. But we can double check and see where we're going to know.
Yeah.
Bylaws.
So maybe a status report at the next meeting or, right?
I do remember there are two other, well, there's one other young lady who was on the board who still wanted, I remember her first name is Virginia, and I remember her last name. She just graduated from UVA. She should have graduated from UVA and I know she's still in town. So I assume that she's one of the holdover members.
Well,
Anthony, if you've got some people in mind, we probably ought to make sure we get their names.
well, it would really be great to have a robust advisory board for CAT, because I could see a place for the business community on that board, perhaps.
Absolutely.
So getting that group up and running again with representatives from the university, perhaps, or the students, I don't know, but Albemarle County for sure, the city, it could be very helpful. So anyway.
I agree.
All right. And before we go, I have to talk about a correction, because Nakaya pointed out to me that the minutes had an incorrect date, I believe, and I think we need to go back and revote on those minutes, because we had 2 abstentions, and I think that was possibly caused by an incorrect date in the minutes. So, and I do think we need to make sure we have all of our I's dotted and our T's crossed here. So we had minutes from February the 27th. And when I looked at the minutes, I could see that B attended and Nakaya said she attended. Is that correct? Because you all were talking.
Well, there was no meeting in January. I went back and looked when she said, made her comment. My name was just, it was absent beside my name listed, and so I didn't even read them. It looked like there was even comments in the minutes, before them. And after looking back, I was at the meeting that Lloyd was at and that she was at. So it must have been.
So can we go back and revote? And I'm sorry, I don't know what the realities of all of this are, Chip, but it does seem like to me we need to clarify the approval of these minutes.
Are we clarifying something in the minutes, i.e. correcting something in the minutes?
Is the date is accurate, I believe. Is that correct?
Yes. The date is accurate, so we just need to correct that Mayor Walker was in fact in attendance.
There you go. So that's the correction. And then if I could have a motion and a second to approve the February 27th minutes with that correction.
I would so move.
Second.
All right. So we have Lloyd has made the motion and B seconded, and all those in favor? Aye. Aye. Any opposed? And any abstentions? So now we have an approved set of minutes. Thank you very much. And I appreciate Nakaya pointing that out to me as we were going through the meeting.
Diantha,
yes.
I was at that meeting then.
Yes, yes.
Sitting next to Nakaya.
Yes. All right.
Yeah.
So Chip and staff, are we good we've managed to accomplish everything we needed to accomplish this afternoon? And
We did.
okay. And then what we will be doing is we will be moving, our next meeting is June the 25th. We'll be moving on to June the 25th. The assumption is that it will be virtual. And I guess with that, hearing no objections, I will declare us adjourned until June the 25th. Thank you.
Thank you.
Thank you, everyone.
Appreciate everybody attending. Stay safe.